who knows nada. My name is Brianna, and this is the Mama Knows Nada podcast. Today we have Dr. Jennifer here to talk about a million different things that she's an expert in. So I don't even know where to begin with this one. So I'm so excited to talk to you, Dr. Jennifer. Thank you so much for being here.
Thank you for having me.
Oh, and I'm really excited. And I was like, I always do like my homework and I go through the websites and I scroll through Instagram, Facebook, and I'm just like, I have a million questions for her, but I have no idea where to start. So let's just start at the beginning. Like, you have a really interesting background in physical therapy and working in pediatrics and neurology.
Yes.
How did you get into that?
Yeah. So I graduated from PT school. And first of all, let me start back and say, I thought I was going to work in sports, right? That was like, everybody wants to work with athletes. They're so cool. Athletes were not my jam at all. I've come full circle and now I enjoy them. But I really found where I can make a difference was in working with people post-brain injury, post-stroke, and then not all that dissimilar when we talk about pediatric physical therapy. We get a lot of children who came in maybe with challenges at birth that left them with cerebral palsy or a genetic condition. And all of that involves the nervous system. So that was probably my kind of big connection between the two of those. I started off specializing in neurology because I had the mentors and the expertise, but then took all of that over and kind of became the mentor and the leader in the area of pediatrics. So I ran a residency program training pediatric PTs actually before I jumped full-time into my practice last year.
Wow, that's incredible.
Yeah, it's fun.
Neurology is a really interesting ball game there too.
Yeah. And I think where I've enjoyed sports now is everybody has a nervous system, right? So that's so underappreciated, but it affects so many areas of our life.
Oh my gosh, that's really interesting you say that, because like there's another podcast to talk about and it's a pelvic floor therapist, and she talks about how like every muscle has a nerve to it, and we get so I'll say this for myself, I get so concentrated on like my muscles and that we forget like the nerves need to be healthy too. I mean, like our bodies are pretty incredible and like highly resilient, I think. So when they are damaged, it's like you really have to pay attention. But I just think it's crazy that you said that, because our nervous system is so important and we kind of forget about it.
Right.
So you kind of already discussed it, but how does like your knowledge in like physical therapy inform the work that you do in pediatrics and neurology?
Yeah. So, as a PT, we really learn about the body as a whole. And I think that kind of is my foundation for what I do. I mean, we learn about the nervous system. We learn about the musculoskeletal system. We learn how all the systems interplay and how movement affects the body. Not just, how do you move, but how does movement, for example, help you detox, help you reduce stress, kind of things we were talking about earlier, right? And so I think that the piece of just understanding the nervous system is kind of probably the crux of where I started my practice, and understanding how people move and how movement impacts our life. So the quality of movement, but also the ability to move. And so in pediatrics in particular, if kids can't access their environment early on, we see delays in learning, we see delays in social skills, all kinds of things, just because they can't move. And so how those systems interact with each other is probably one of the most exciting things for me as a pediatric PT.
That's interesting. What in your experience with like your clients and patients, what do you think that people misunderstand about their nervous system?
I think sort of like you, they just kind of forget it exists, right? Unless we have a headache, and not that you forget, but right, you're like, oh yeah, I guess that is important. Yeah. Right. Unless you have a headache or a true something going on with your nervous system that you say like, oh, I had a brain injury or a concussion, then we think about the nervous system. But the nervous system informs everything we do, right? So those connections between our muscles and the brain and back down to do something about it is part of every single movement we make. And so I think that is probably one of the pieces that drives my progress as a therapist, but also as I've jumped more into functional medicine, which we'll talk about later. Some of the pieces that have really kind of brought it full circle, and that nervous system doesn't just interact with movement, but with sensation, with feelings, with emotions, with stress, and all those other things as well.
Oh, that's a good point, with the feelings and emotions and stress. Like, and you know, I think it's kind of like our heart beating in a way. Like, we forget that the nervous system is attached to everything. Like, we don't have to think about pumping our heart or our lungs feeling what they're just like. There's like our autonomous, like our nervous system, generally speaking, kind of works without us doing much. You know, it's just.
Right.
You know, you cut yourself, you feel it, you know, you hit your head, you feel, I mean, I've had a lot of concussions, unfortunately. And I am not a football player. So it's interesting. That's fascinating. So let's talk about how you had this shift from your practicing like a traditional physical therapy kind of studying background, et cetera. And then you did this like shift to a more functional, like holistic wellness approach. What prompted that, you know, jump for you?
Yeah. So I think part of it is my just desire to be a lifelong learner. And so as I've learned more about my specialty in PT, I realized there's so much more to it than the nervous system and the muscles. And so kind of taking that to a bigger picture of what else in our life influences our health in order to optimize function. And then my own journey. I really thought I was a pretty healthy 20-something-year-old until I started on the path of a more healthy lifestyle and realized things like gut health can influence my hormones, how grounded I feel, how well I'm sleeping, and all of those other factors that needed to be optimized in order to have this better health. And then I went on a journey of learning more and being trained in that area so that I could help other people as well.
I mean, gut health, man, that's a whole different topic for a whole different day. but yeah, it's super important. How does your approach to like wellness and I'll say like recovery, because like the physical therapy, like neurology, and how does that differ from other practitioners?
Yeah. So primarily in my practice right now, I see children, and young families. And one of the things I've realized is if they're not thriving as a family, if their sleep isn't on point, if they're constantly functioning in chaos, if their diet is terrible, right? It doesn't matter how great the PT is, they're not going to get better because they just can't do it. And so I really tend to take a more global approach to kids in development, looking at the holistic picture of health in that family. Let's talk about not only what you need to do from a PT perspective, but how do we integrate that into a more holistic lifestyle approach so that the family has a better sense of who they are, they function better, there's less chaos, maybe more grounding, and they just are able to then produce better outcomes for their children.
What do you mean by like chaos? Like, what does that look like? I feel like this is a provocative question, but I'm going there.
This might be a loaded question. No, and so I think it's hugely important for anything to fit anybody's lifestyle. So I'm not going to come in and say, oh, you need to sleep train, or you've got to have this many meals and this kind of snacks. That's not my approach at all. It's rather, what do you value as a parent, and how do we prioritize that so that your household has a rhythm, right? Sometimes household rhythm is chaos, but at least it's a rhythm and the children know what to expect, versus, coming in and saying, okay, well, here are some ideals, but I can say, here's some research-based reasons why having meals together as a family are important, how that's going to help your child's development. Or having a consistent bedtime and a bedtime routine is going to help them sleep better, which is going to help them learn better, which is going to optimize the things we're trying to teach them from a therapy perspective. So again, I don't want to come in and say it needs to be this way, and I can tell you my household isn't regimented like that, but I think there has to be a rhythm to the family in order for the child to know what to expect, to be in a calm state, to then be able to learn.
I like that you say that, like a rhythm, because I think, like you say, like every rhythm is different for every family. And that's, I think that's like the more I talk to people, the more I realized there's all these generalities out there, and they have to be general because nothing is a one size fits all in life. So I like that you're saying that. And I also think it's interesting that you like say chaos can be a rhythm, because there's definitely households where like, I can't find my keys when I put them in the same place, but I know that they're on the counter by the drying rack in a stack of papers, and that chaos, like that chaos works in my brain, but not for everybody's brain. So I kind of want to like lean into this chaos thing, because I feel like this is really interesting. In what ways does chaos impact our nervous system?
Yeah. Oh gosh, I feel like we could spend a whole hour on that as well, but I'll give you the 10,000 foot view, right? So imagine back in the day when we were being chased by tigers, right? Or that was our lifestyle. That constantly increased our sympathetic nervous system. And that was meant to be. It was meant for us to survive. And so it does things to our life like shut down our ability to digest food in the moment, because we got to put all our blood supply into running away from the tiger. Well, now we take that and we apply that to daily life. And the reality is we're bombarded with information all the time. You know, social media, there's so much technology. The kids are used to consuming stuff at a high rate, and it keeps our nervous system elevated all the time. So we don't have that chance for the parasympathetic system to come in and allow us to do the work like digesting our food and bringing on healing to our body. And so that sympathetic elevation can be a problem to everything else in our life.
Learn something new every day. Oh man, I'm just like letting that like stew in my brain, like no wonder I feel so tense all the time. Like that's why I'm coming, like, you know, as somebody who's trying to learn and engage, and I feel, now that you say that, it's like I feel like I'm always like running from the tiger, you know, like, and how do you find that? How do you get your nervous system to calm down? This is not a question that I sent you. I told you I was going down rabbit holes.
I love talking about it. That's great. I love it, because I think this is important, and part of why I do what I do, right, is we all function like that, especially as moms, right? Like, okay, I'm late for work because my son didn't, this is real life this morning, my son didn't want to eat breakfast and he's throwing a fit, and I'm not just going to throw him in the car without food. So we're just going to work through this, and I'm going to be late for work. Yeah. That's chaos, right? That's real life as a mom. And so I think it's super important that we, one, can take stock of that and realize how it's affecting our whole body and how we feel, and how you might feel it in tight muscles or an achy neck or a headache or any of those things. And then how do we decompress from it? I think it's being cognizant, right? So if we've had a super stressful day, what are we doing to bring it down a notch? Things like, you know, detoxing from media, right? So not being on our phones scrolling until bedtime, but having a nice calming bedtime routine, just like we talk about with kids, right? We don't just throw them into bed. We like read books and take a bath and all those things. As adults, we probably need to have some similarities to tell our bodies, like, it's time to calm down, bring that energy down a little bit so we can sleep better. Breathing exercises, and this is one I do a lot. I will at least twice a day. So when I leave for work and when I get home from work, I will sit in the car for 1 minute and just breathe. And I've added meditation to that, but just some deep breathing, counting in, exhaling slowly, can stimulate our vagus nerve, which is part of our sympathetic decompression, a parasympathetic response. So those are kind of two ways that I've tried to incorporate. And one, I think, you know, everybody has 2 minutes a day, right? We spend 2 minutes scrolling through social media at least. So you could definitely put the phone down and breathe for a minute and just think about nothing. I know. But I feel like that's a place to start if you're not doing anything else, and then taking stock and seeing.
I love that. I mean, it's funny. I was just writing like a post, and I was like, it's about yoga, and I've made it a point to start doing yoga regularly, because I feel like I've been talking about this in every podcast, but I play a lot of tennis now, and everything's so tight. Like, we're talking before we hit record, like, about it, and so I'm like, I got to stretch, but then, you know, it's all about like the breath, like the more. And I really like that your background went from like a traditional, like I'll say like Western style medicine, and brought in like this functionality component, because if you look at different like modalities or practitioners who might do things differently, like my acupuncturist, like my, you know, chiropractor, like a nutritionist, like a functional nutritionist, like they're going to tell you that breath has a lot to do with a lot of things. And that is something that we lose all the time. Funny enough, I tell my toddler to take a breath when he's upset and, you know, going crazy and, you know, at this emotional climax. But yet when I'm at my emotional climax, I'm not doing that. But that's exactly what I need in that moment. So I just think it's so, I just want to like kind of marinate in this breath thing, because independent practitioners have said that that's in like these podcasts, like how vital it is. So I love that you said it, unknowing what they're saying, and that just really like resonates with me. So that's pretty cool. Now, about your background and your knowledge, how does it make your approach successful when you're taking on like a patient, especially like these children that might have some neurological issues?
Oh, yeah. So I think a big part of it, when we talk about the nervous system, so we just got done talking about how do you manage a healthy nervous system. And so now you talk about a nervous system who's had an impairment to it. And whether I'm talking about a child with a neurologic disability or an adult who's had a lot of chronic pain, their systems are not all that different, right? They're atypical. They're usually overstimulated, hypersensitive. And so all of those things need to be part of my treatment. So whether I'm modulating a low nervous system in somebody who's maybe had a brain insult or something like that, or a high nervous system in somebody who has chronic pain and a lot of stress that's contributing to that, both of those things require attention. And so maybe that's someplace that in a more traditional medicine approach or even a more traditional therapy approach, that might get lost. So that's one piece of it that I think we've gotten better as practitioners at, but it certainly isn't fully integrated in every practice yet. And then the other piece is just looking at that holistic person from a more lifestyle approach. So how is their diet? Are they eating something that's contributing to that inflammation and causing that nervous system to be heightened? Or are they eating something that's going to help their nervous system heal, help their bodies be optimized for healing and for recovery or for learning new skills, depending on what we're working on? And then we do that with other things like sleep, stress, relationships, looking at, all of those components. And I ask all of that in my PT exams. And sometimes I get some really funny looks because what does this have to do with my body, right? Or my leg or my this? And the reality is it has to do a ton, but not every practitioner fully understands.
Dang. I do think it's kind of interesting. And it's like how you built on all these different things. And it kind of seems like it, obviously I've never visited you as a patient, but it feels like you can really kind of like take that whole being and like really hone in on something that could just be specific to that individual, which is pretty valuable.
Absolutely.
So you're talking about this functional wellness piece and how and your physical therapy and how you integrate it. Are there any misconceptions about like a functional practice that you'd like to address?
Yeah, I think it's something that people are still learning a lot about. So I had a great conversation this morning with an oncoming client, and she said, okay, so how do you differ from primary doctor or a more Western approach to medicine versus like a naturopath and a more Eastern approach to medicine? And I think and obviously I'm biased because I love this practice and I love what I do, it's a nice blend, right? So we aren't totally throwing out the Western approach. There's some things from that are really valuable, and there's some treatments that we have that are really amazing. However, there are also really important things from Eastern medicine and understanding how the whole body functions and a more natural approach to treatment when possible to avoid those medications and things like that are really integrated into a functional practice. So we talk a lot about wellness and staying well and being well and how to optimize wellness. However, there is a reason and an opportunity and a time when a more Western and traditional approach is necessary. And that's what I really love about what I do, is being able to work with the providers who then manage that when sickness or unwell comes on.
Awesome. I love that. Okay. So you also have a bunch of different programs that you offer, which are...
Yeah. We have a lot going on in our clinic.
I was like, wow, this is crazy. Let's just start with the therapy and wellness.
Yeah, so our background and Altogether Wellness really came about more as a traditional therapy clinic. So with a twist, we were doing early intervention, which is usually done in the home environment. And so we've expanded that to children who don't qualify for early intervention as a state-run program, because we love that model of being in the home. You bring a child to a clinic, you show them what to do, that's great. You send them home, they don't have those same toys, they aren't going to be able to reproduce it, and practice on that nervous system is what creates change and growth. So being able to go meet that child at their home, at their school, at their playground is something that's so critical. And we do that with our adults as well, right? So I do treat athletes now in the gym, and I'm right there with them, right? I don't see them in the clinic and then tell them to go deadlift. We pull out the bar and deadlift to practice it. And so it's, meeting whoever, wherever they play, that's where we're at. And our team is awesome for that. So I've got a great team of PT, OT, speech, and developmental specialists that all work in different areas of Jacksonville doing that. Then we have our coaching program, which kind of came as a result of what we were seeing in the home. So, families, like I said, some just function in chaos, or they don't function in chaos. And so Crushing Motherhood really was the program for moms by moms, created to help you figure out what's your rhythm and how do you achieve that optimally so your family functions, to help appreciate mom's health and why that's so important. And then the relationship with the child, the relationship with the spouse, the siblings, all of that, and how that integrates, and how do you optimize that without feeling like you need to be 100 people in order to take care of your household. So we really target moms and the rhythm of the family.
That's awesome. But you also have like a functional medicine program too?
We do. And so that is something we've been offering. So that is me as the functional medicine practitioner in our practice. We've been offering for a couple of years on more of a consult-to-consult basis. But what I've really found is people who come to that decision that they really need functional medicine need a more holistic and integrated approach. So we have launched, actually this month, our program in that. So it's 16 weeks. It's focused on testing, not guessing, figuring out what's going on with that health, and then optimizing it and helping that individual optimize that, not just for that 16 weeks, but then forever, giving them the tools to understand how lifestyle, stress, diet, all of that plays an impact in their overall health and keeps them
Okay, so you're like going through and saying like, here's gaps or like a potential issue. This is how you can change something, or, finesse like a diet, an exercise, or just like a lifestyle, and make those micro changes for like macro benefit kind of thing. Oh, that's awesome.
Yeah. So it's a lot of a lifestyle. And then we also look at, hormones might be off. I work with a lot of moms who have totally drained themselves, right, over years of having young children at home. And so I feel depleted. I have no energy. I'm having trouble losing weight, even though I'm eating well. So let's look at your hormones. Let's figure out what's going on. Let's provide you with a lifestyle approach to change that, but then also maybe some supplements to optimize that and get you back on track to be the healthy, energetic.
And then you also have genetic testing?
We do. So this is super fun and something I offer individually, right? So the rest of it, we kind of have services and packages, but genetic testing is one of those things I think can be super helpful for somebody who maybe isn't quite ready to jump on the full functional medicine train, but wants to know more. So we have a couple of different tests we offer. One for moms in particular is called Grow Baby. And so this is a genetic test that can be looked at ideally maybe pre-pregnancy, but certainly early pregnancy, to help optimize mom's health throughout the pregnancy and throughout those first couple of years of baby's life. So things like genetic, I'm sorry, what are we looking for? I know, right? It's like mom brain at the end of the day. Like gestational hypertension or gestational diabetes are both things that we test for in there. And there are some different SNPs that we know are more likely to contribute to those things developing. So we can make lifestyle and diet modifications early on in pregnancy, maybe, adding more fish or adding more B vitamin or those kinds of things too, then help ensure a healthy pregnancy. And the coolest thing to me is that we know that some of those factors, like gestational diabetes, gestational hypertension, can be risk factors for the child's health in adulthood. So if we can prevent them, we're actually changing generations of health.
Dang. Cool. Do you offer that for just like non-mom, like non-pregnant people?
We do, yeah.
I want to know.
So we definitely, So there's some different testing. So that is specifically kind of targeting the moms and the mom-to-bees. There's a sport-specific one. So thinking about like, I'm an athlete and I want to know, do I train better in strength training or endurance training? Do I do better with caffeine, or am I somebody who doesn't metabolize caffeine well? All of that kind of comes out of the testing there. And then there's just some more general one of like overall health as well. So those are 3 of the ones that we like to use.
That's awesome. No, that's really fascinating because I've always thought of like genetic testing and like a certain parameter. So it's like to know that I could go in and have, how can I optimize myself? You know, I don't want to know about the caffeine thing because I love coffee.
Fair enough. But just ignore that part.
The hormone things, like in my thing, like for me personally, like they'll tell you that my hormones are normal, but I got them tested like almost 2 years ago. And that was for a completely different thing. I thought I was suffering from, PMDD, not like PMS. So like that, like a really aggressive kind of like form of, PMS. And they're like, no, you're perfectly normal. And I'm like, well, then what is wrong with me? I'm
don't feel normal,
is not
right?
normal. Like this is, or maybe it is normal and we're not talking about it. So I got to talk to some more people. But like all my hormones like came back like normal. So I'm like, okay, so what is it about me? So that I find that like really interesting to know that I could just go and be like, what am I genetically disposed to, or how are my genes expressed like currently?
Yep.
Interesting.
Absolutely. Yeah. And that's what I love about functional medicine is it takes a deeper dive in a lot of the testing. So we do testing in our functional program as well that might look specifically at hormones, not just a blood panel, but what happens as your hormones are metabolized. So we look at the metabolites actually in your urine, which gives us a better picture of what's happening throughout the day with your hormone levels.
What's a metabolite?
Hey, they're not just normal. So those are the way your hormones break down. Like the things that come out as your hormones are being used in your body, basically.
See, look at all this education I didn't even know. I didn't even know I needed to know this.
I know.
This is amazing. All right.
That's why you need a functional provider.
No other doctor is like... certain, it's like even hints. I mean, sorry. Anyway, so how would you, what's like a consultation look like if I walked into your office today?
Yeah. So I think this is totally different than a traditional visit. And so I'm glad you asked that question, because if you're coming to me to talk about functional medicine, we're going to sit down for a while and I'm going to give you some homework ahead of time. So I really want to know everything about you leading up to this point. What kinds of antibiotics you've taken, what kinds of challenges you've had with other health conditions in your life, when you've needed surgery, what did that look like, how did you recover from it? Because all of that gives me a picture of what might be going on underneath and helps me better direct treatment and testing. So you'll have homework if you come to see me, first of all, and then we'll sit down for probably an hour and go through all areas of your life and talk about what are your stressors, what are your relationships like, where are maybe some undiscovered things, what might be those health things that are contributing, what's your diet look like, are you eating regularly, are you sleeping well, do we need to do something to start to fix those? And then based on that whole picture, leave with some recommendations of things to do today, some tests to start running, and a clearer picture of where we're going and how we're going to get there. And then from there, we'll follow the plan.
That's good stuff. I want to circle back a little bit to the nerve thing. I'm really caught up in this. My brother has the MS. So anytime I talk like, and you were saying something about how if you're in a clinic and the kid doesn't have, the same, things at home to utilize to like repair that nerve damage. Are you saying that through like practiced like skills and essentially like homework or like, I guess, repetitive things, like you can rebuild some of your nerve like damage?
Yeah, that's a great question. So yes, neuroplasticity is the term for that. So it's basically the regeneration of your nervous system. And there's lots of different principles that fall into that, but a couple of them that are kind of important to that home environment are what we call basically salient. So is it important to the patient? So it has to be something the nervous system cares about, i.e. the patient cares about, in order to maximize that neuroplasticity. So if I've got you moving cones from one side of the table to the other, that's probably not something your nervous system cares about. But putting dishes from the drying rack into the cupboard, at least is something your wife cares about, right? So So it's more important to them. There's a function to it and an importance, and that can be a big piece. Another one is what we call transference. So ability to take a skill from one environment to another, and that's harder to do. That's a more high-level skill. So if you can practice in the exact same environment with the exact same chair, the exact same sofa, whatever you're playing with, that nervous system has a better ability to build on that, and then we can transfer it to a different room and a different chair and a different sofa. But starting out, the nervous system is better able to handle it if the environment looks the same. Those are just a couple of the pieces, but yes, definitely important to make it relevant, meaningful, and as close to what they're actually doing on a daily basis.
That's fascinating. All these things, I'm just like, what? Anyway, is there anything that we didn't cover? Yeah. Is there anything you feel like I didn't ask or you want to share? Oh no, there's a lot of good stuff.
I feel like we covered a lot. And we covered a lot at a really high level. So I think if somebody's wondering, like, is this for me? Or maybe there's something for me here that I want to dig deeper, I'm happy to have a conversation. You can book a call on our website and have a chat with me to find out, are we right for you? Can I direct you to somebody who would be? And, just answer any.
Can you share your website?
Yes, it is altogetherwellness.net.
And then are you like on Instagram or Facebook or anything like that?
We are on both Instagram and Facebook. And those are great pieces too if you're just thinking, okay, this is interesting and I want to kind of marinate in this a little more. We like to put out a lot of content and just kind of bring those little tidbits to the surface and get people thinking a little bit more. So we've got some good stuff out there.
I'm gonna brainstorm some questions for round 2 because I think there's a lot more to delve into here.
We can do that.
Oh, thank you so much, Dr. Jennifer from Altogether Wellness. Again, you can find her at altogetherwellness.net. You can look them up on Instagram. So that's pretty fascinating. I really appreciate your time. Definitely intrigued by all of this and all that, how you fuse these, professions. Because they're all kind of like independent, like pediatrics, neurology, like how you fuse them together to be like so comprehensive is pretty fascinating to me. And a lot of work. It sounds like a lot of studying.
I know, but I enjoy that. I'm kind of a neuro nerd. So, when it comes to that stuff, I soak it all in, and I'm probably reading way more nerdy stuff for fun than anybody else.
I wish I was nerdy like that. That's a good thing. I love it. Well, thank you so much for your time. I really appreciate your insight, and I can't wait to learn more because I didn't know I needed to know all these things. It's incredible.
Well, I'd be glad to come back. So thank you so much for having me, and I'll talk to you soon.